We trust that the medicine on our pharmacy shelves is safe, effective, and, well, available. But behind every single pill is a hidden journey, an invisible pipeline that is way more fragile than you'd think.
And this quote, it just nails the feeling of shock so many people had back in late 2022. What should have been a routine trip to the pharmacy turned into a moment of real panic. It was this wake-up call, right? It revealed a deep vulnerability in something we all completely depend on.
I mean, it's a mystery that goes so much deeper than just a simple delivery problem. It brings up this really basic question. How does a drug we've been using for decades, one that costs pennies to make, suddenly just vanish from shelves all across the Western world?
So, it all kicked off with the triple-demic in late 2022. Respiratory illnesses were surging, and parents, looking for that standard, pink, bubblegum-flavored amoxicillin for their kids' ear infections and strep throat, found nothing. Pharmacies were rationing. People were driving across state lines just trying to find it. It was chaos. And let's be clear, this wasn't just a snowstorm blocking a few trucks. This was a widespread, systemic failure. And just like that, the illusion of abundance was shattered for a medicine that's been a cheap, reliable staple for almost half a century. So what that whole mess showed us is this fundamental truth. That familiar brand name on the box, whether it's from some trusted American or German company, tells you almost nothing about where your medicine really comes from. That box is just the final stop on an incredibly complex, globe-spanning journey.
Okay, so to really get a handle on this vulnerability, we've got to follow that journey ourselves. Let's, unpack the box and trace a single pill all the way back to its surprisingly industrial roots.
All right, the whole thing basically boils down to 4 main stages. Now, to make sense of it all, we're going to start at the end, with the part you already know, and work our way backward, deeper and deeper into the industrial heart of this whole supply chain. So, stage 4, that's the finished drug, the actual pill you hold in your hand. But honestly, think of this as just the final assembly. The analogy here is perfect. It's basically just screwing the wheels onto a car. The real engineering, the core value. That all happened a long, long time ago and far, far away. So where's the real engine of the car, right? Well, that brings us to stage 3, the active pharmaceutical ingredient, or the API. People have called it the drug's molecular soul, and that's exactly what it is. This is the actual chemical that makes you better. Without the API, you've just got a piece of chalk. But before you even get the API, you have what are called intermediates. Think of these as the chemical scaffolding. You see, making a complex drug isn't just one step. No, it can take 10, 20, sometimes even 30 separate chemical reactions. And each one creates a new intermediate molecule in these massive industrial reactors that honestly look more like oil refineries than some clean white lab.
And where does it all begin? Stage 1, raw materials. And we're not talking about anything fancy here. We're talking basic commodity chemicals, like benzene that comes from refining oil, minerals dug out of a mine, or even byproducts from corn.
Now, you'd probably assume this entire long process is super heavily regulated from start to finish. Yeah, not so much. There's actually a very specific point where the rules kick in, a kind of line in the sand that ends up shaping the entire global system. That line is drawn at a specific point called the Key Starting Material, or KSM. This is the exact chemical step where the strict, expensive, pharmaceutical-grade safety and quality standards have to start. These are the rules known as Good Manufacturing Practices, or GMP, that make sure every batch of medicine is pure and safe.
And believe me, the difference is night and day. Everything that happens before that KSM point is non-GMP. It's cheaper, has way less regulatory oversight, and can be done in pretty standard chemical plants. But the moment you cross that KSM line, everything changes. Now you're in the GMP world of expensive, sterile facilities, rigorous inspections, and mountains of paperwork.
So what does this do? Well, it creates this massive financial incentive for companies to define the KSM as late in the game as possible. It lets them source all these complex chemical components from cheaper, non-GMP plants, hiding dozens of steps in this kind of regulatory gray zone that's basically invisible to Western regulators, like the FDA.
And all of that economic pressure, it's caused this huge shift in where our drugs are made. So let's zoom out now and see how this system ended up creating a seriously dangerous global choke point.
Okay, just think about this for a second. Generic drugs. They now make up about 90%, that's 90, of all prescriptions filled in the US and Europe. We're talking about the workhorses of medicine, your antibiotics, your blood pressure pills, your statins, and they all run on razor-thin profit margins.
And to survive in a market like that, where you're competing on pennies, you have to find the absolute rock-bottom price for your key ingredients. This pressure is exactly what's driven the mass exodus of that crucial API and intermediate manufacturing from Europe and the US to Asia over the last 30 years.
So when you walk into a pharmacy, this is what you see, right? It looks like a healthy, competitive market. You've got all these different brands to choose from. It gives you this feeling of choice, of a resilient supply chain.
But here's the secret hiding behind the shelf. Behind all those different boxes, all those so-called competing companies, a lot of the time, they're all buying their most essential ingredient, that API, from the exact same factory, usually somewhere in China or India.
And this creates a structure that experts call a diamond supply chain. Picture it. You've got lots of different brands up at the top and tons of raw material suppliers down at the bottom. But right in the middle, the whole global supply gets squeezed through this tiny, dangerous pinch point, sometimes just a single factory making that one critical API.
And look, this isn't just some theory. This has already happened. Back in 2016, a key factory in China exploded. Turns out it was the world's main source for the API of a really important hospital antibiotic. And just like that, the entire diamond collapsed. All of a sudden, hospitals all over the world were facing the same critical shortage at the exact same time.
So the takeaway here is pretty clear, right? Who controls these invisible chemical ingredients? It's not just a business question anymore. It's not about saving a few bucks. This has become a central issue of global health security and, honestly, national sovereignty.
Okay, first, let's talk about the push factor. I mean, why did Western companies, who used to absolutely dominate this industry, why did they just willingly walk away from making their own essential medicines? It's a story of a huge and maybe really short-sighted retreat from manufacturing. You have to remember, it wasn't always this way. Not that long ago, things were the complete opposite. The United States and Europe, they were the undisputed kings of pharmaceutical production. They had the factories, they had the expertise, they had total control over these critical health assets. The entire story can really be told by looking at the life of just one factory, the Bristol-Myers Squibb plant in Syracuse, New York. It was started during World War II specifically to make sure the country had penicillin. It was a symbol of American industrial might, but by the 2000s, the cost pressures were just too intense. In 2004, it shut its doors for good. The equipment was sold off at auction, and with it went generations of knowledge. So what caused this? Well, it was a perfect storm, really. You had drug patents expiring, which turned medicines like penicillin into cheap, low-margin products. At the same time, shareholders were screaming for higher profits every single quarter. And on top of that, strict environmental rules made the messy business of making chemicals more and more expensive in the West. For a lot of companies, these factories just started to look like dirty, high-risk assets they couldn't wait to get off their books. And this quote, it just says it all. While executives were focused on the next earnings report, something way more important was being lost. By the time anyone really noticed the strategic problem, the physical factories were gone, and even worse, the people, the experts who knew how to run them, had retired or moved on. All right, so while the West was getting out of the business, China was doing the exact opposite. They saw this incredible opportunity and ran a brilliant industrial playbook to basically capture the entire industry. This is how they built their dominance, step by step. A big part of their early strategy is explained by something called the pollution haven hypothesis. It sounds complicated, but it's simple. Basically, China opened its arms to all the dirty, heavy industries that the West didn't want anymore. By having fewer environmental rules at the time, they created this powerful magnet that just started pulling all that production eastward. But it was so much more than just regulations. The real genius was how they physically set up their industry. Think of a Western plant like a lonely island, having to handle all its own supplies and its own waste. China, on the other hand, built these gigantic industrial parks that were like fully integrated ecosystems. They created efficiencies an old standalone factory could never dream of matching. They called it the over-the-fence model. It's brilliant. If your factory needed a specific chemical, you didn't have to truck it in. Nope. It was just piped over the fence from your neighbor. Your wastewater? Piped out to a huge central treatment plant. Steam, energy. Everything was centralized and usually subsidized by the government. This just created an absolutely unbeatable cost advantage. So, with this hyper-efficient industrial machine built and running, China made its final move to completely lock down the global market. they used some really powerful financial tools to just knock out any remaining competition. It was, for all intents and purposes, checkmate. And a huge part of that final move, it comes down to this one number, 13%. What in the world could that mean? It was a value-added tax rebate. Basically, the Chinese government gave a discount of up to 13% to any foreign company that bought their drug ingredients from a Chinese supplier. The government was literally paying foreign companies to drive its competition out of business. And the effect on other countries was just devastating. I mean, look at India. They had their own strong fermentation industry, and it was pretty much wiped out. How could you compete with that? Indian companies couldn't. They had to shut down their own factories and start buying the very same ingredients from China that they used to make themselves. And the craziest part? This wasn't some kind of secret plot. It was official government policy written down for everyone to see. The Made in China 2025 plan made it crystal clear. The goal was to dominate not just the simple stuff, but the most complex and valuable parts of the pharmaceutical industry too. And to make that a reality, the state funneled an almost unimaginable amount of money into the sector. This number, 156 billion euros, that was the investment in Chinese chemical and pharma plants in 2024 alone. That's more than any other country on Earth. Now, the strategy behind that insane number was to create massive overcapacity. You build way more factories than the world even needs. Why? Because then your companies can flood the market, drop prices so low that no one else can survive, and once the competition is gone, you have complete control. And all of this, it brings us to where we are today. This whole decades-long story has created a brand new reality. And it forces us to ask a tough question. What was the real price of all that short-term efficiency? Because now we're living with the consequences. So when you boil it all down, it's really a story of two completely different mindsets. The West focused on quarterly profits, treating manufacturing like a problem to get rid of. China played the long game, a national strategy that saw pharmaceuticals as a core strategic asset. In the end, their integrated ecosystem model just crushed the old isolated factory model. A critical dependency was traded away for a lower price tag. So let's take this little guy. A simple ibuprofen pill. Seems pretty straightforward, doesn't it? But its real origin story is a globe-spanning epic of chemistry and economics. And to really understand where this pill gets its start, we first have to get familiar with one crucial term. And that term is API. It stands for Active Pharmaceutical Ingredient. Now, you can think of the API as the magic ingredient. It's the actual chemical that fights your headache or stops an infection. Everything else in the pill? That's just filler, or the coating. The API is the part that actually does the work. It's what really matters. Okay, so to get to the bottom of all this, we're gonna follow the trail of a single ibuprofen pill all the way back to its source. And this journey is gonna take us across the globe and through several layers of a supply chain that honestly is almost completely hidden from view. Our first stop lands us in what has basically become the world's factory for these core ingredients, China. We're gonna look at its absolutely dominant role in producing the APIs for the entire planet. The scale of this operation is, well, it's immense. By sheer volume, China produces an estimated 40% of all active pharmaceutical ingredients used across the globe. Just think about that for a second. That is a staggering market share for one of the most critical products in the world. But here's the kicker. That huge number, 40%, it actually hides the true story. It masks the real extent of the world's reliance. Because when you start to drill down into specific life-saving types of medicine, the picture gets a whole lot clearer and a whole lot more stark. Yeah, 90%. For essential medicines like antibiotics, the very foundation of modern healthcare, China's share of the global API supply just skyrockets to 90%. That's not just dominance, folks. That's a near total monopoly. Take penicillin G. It's a perfect example. This stuff is the foundational building block for almost all penicillin-based drugs. Think Amoxicillin, Ampicillin, all the classics. And its production? It's almost entirely concentrated in the hands of a few massive companies located in just 2 Chinese provinces. If they stop, the world's supply of these critical antibiotics just grinds to a halt. Now, I know what you might be thinking. Hold on, what about India? Isn't India called the pharmacy of the world? And that's a really fair question. It's one we absolutely have to peel back to understand what's really going on here. The source material we're looking at puts it bluntly. That name, pharmacy of the world, is deceptive. You see, while India makes a ton of the finished pills that end up in the US and Europe, its own industry is completely structurally dependent on another country. It creates what's known as a transitive reliance. Let me break it down. So the West relies on India for finished generic drugs. Simple enough, but India relies on China for the APIs to make those drugs. So what you really have is an indirect but absolute reliance on China. If something disrupts production in China, production in India stops cold. And that means pharmacies in the West run out of medicine. It's all connected. And the numbers here are crystal clear. About 70% of the APIs that India's entire drug industry uses are imported from China. And for those critical antibiotics we talked about, that number jumps to nearly 90%. So yeah, India is a vital step in turning ingredients into pills, but it is not the source of those core ingredients. Okay, so we've gone from the pill in your cabinet back to the API. But the story doesn't end there. Nope. There's one deeper layer to peel back on this onion, and it's the most fundamental of all, the raw chemical building blocks themselves. And this is the KSM, or key starting material. You can't make an API without a KSM. It's the absolute base of the pyramid. If you don't have the key starting material, you just can't make the drug. It's not possible. There is no substitute. So let's bring it back to our little ibuprofen pill. Its journey actually begins with a specific key starting material called isobutylbenzene. And guess what? The global supply of this essential chemical is also dominated by China. This is the true beginning of the journey. And this right here is why official figures can be so misleading. You might see a study that says direct US reliance on Chinese APIs is pretty low, maybe somewhere between 13 and 25%. But that completely ignores this hidden KSM layer. When you factor in these foundational building blocks, the effective reliance, the real reliance for so many essential medicines gets dangerously close to 100%. In fact, a recent analysis found something pretty incredible. For over a third, 37% of all drugs approved for use in the United States, China is the sole supplier of at least one key starting material. Let that sink in. For more than 1 in 3 medicines, there is no alternative supply chain anywhere on Earth that doesn't start in China. Now, this situation, it isn't static. It's not just staying the same. Having built this dominance over the foundational building blocks, the market is now evolving. And the data points to a really clear, really strategic next move, a shift from just controlling the volume of drugs to controlling the value. So how can we see where the market is going? Well, a key indicator is something called a Drug Master File, or DMF, which gets filed with the US Food and Drug Administration. You can think of it as the official paperwork a company files to become the primary supplier for a brand new drug. And what happened in 2024 is a huge deal. For the first time ever, China actually surpassed India as the top holder of these new API filings. They accounted for nearly half of all new applications. This is a massive signal of who is getting in position to control the supply chains for the medicines of the future. What this data really signals is a major strategic pivot. It's a move away from just dominating the high-volume, low-cost generics, like basic antibiotics, and moving toward dominating the high-value market. We're talking about the complex APIs needed for next-generation cancer drugs, advanced biologics, the really cutting-edge stuff.
Okay, look at this number. 81. What do you think that means?
This isn't some abstract number from a textbook. It's the real human cost of a single breakdown in our modern medical system. 81 people died because a drug they were told would save them was actually hiding a deadly secret. And their story, well, it pulls back the curtain on a massive flaw in how we get our medicine.
And the thing is, this tragedy wasn't just some freak accident. Nope, it was a symptom of a much bigger problem, one that's lurking just beneath the surface of global healthcare. Which brings us to our first section, a deadly secret.
Okay, so it all goes back to the 2008 heparin scandal. Heparin, it's a super important blood thinner, and it's made from pig intestines. Well, a pig disease swept through China, which created a shortage. So one supplier came up with a fix. They secretly mixed the raw heparin with a cheap, toxic chemical that mimicked the real thing. The system completely missed it, and the result? It was absolutely catastrophic.
So you gotta ask, how on earth does something like that even happen? Well, the problem boils down to something called an opaque supply chain. Basically, Companies in the West weren't buying ingredients from the source. They were buying from middlemen, who were buying from tons of tiny, unregulated workshops. The whole journey was so broken up, nobody could see the full picture.
And here's the kicker, the part that's just mind-boggling. There was a massive regulatory loophole. US inspectors couldn't get into a lot of these Chinese facilities because, on paper, they were just chemical plants. By not calling themselves drug makers, they basically flew under the radar of any real oversight until it was way, way too late.
This complete lack of transparency, it comes at a huge price. And the heparin scandal, it wasn't a one-off. It was a giant red flag about a risk baked into the system, a risk that was about to show up again.
Fast forward 10 years to 2018 and boom, it happens again. This time, it's a blood pressure drug called valsartan. It had to be recalled because it contained a substance that likely causes cancer. Now, what's really important here is that this wasn't deliberate sabotage, it was an accident. A manufacturer in China had changed its process to get more product, and that change unintentionally created the poison. And regulators in the West had no clue.
There's a quote that just nails this entire problem. When control of the ingredients is lost, control over quality and safety is also lost. It's as simple and as terrifying as that.
And this right here, this is the absolute key takeaway. The thousands of miles separating a factory in China from your local pharmacy, that isn't just about geography. It's an information gap. It's a black hole where quality issues can hide, fester, and become deadly.
But the danger here isn't just about bad ingredients getting through. The whole system has another huge vulnerability. It is incredibly brittle, and not by accident. It was designed that way.
See, for decades, the name of the game has been hyper-efficiency. Companies use what's called just-in-time manufacturing, which is a fancy way of saying they keep almost no extra inventory on hand to cut costs. And yeah, it works great, as long as nothing, and I mean nothing, goes wrong. But it leaves absolutely no room for error. There's no backup plan.
Think about it. In a healthy, resilient market, if one supplier goes down, other companies can just step in and pick up the slack. The system absorbs the shock. That's how it's supposed to work.
But that's not the world we live in, not even close. Our market is incredibly concentrated. We rely on just a handful of giant suppliers for some of our most critical medicines. And in that kind of system, there's no buffer at all. And we've seen exactly what happens when it breaks.
Just look at what happened. In 2016, an explosion at one single factory in China led to a worldwide shortage of a crucial hospital antibiotic. Then, a year later, China launched its Blue Sky Environmental Plan. A good idea for sure, but it meant thousands of chemical plants shut down like overnight. The result for the rest of us? Pure chaos. Shortages, crazy price hikes on everything from antibiotics to vitamins. And that brings us to the final risk. And honestly, it's the most chilling one of all. What happens when these disruptions aren't accidents? What happens when a country decides to control the supply of medicine on purpose? Right, so everything we've talked about so far, explosions, policy changes, those are accidents. But there's a whole other category, intentional leverage. This is when medicine stops being just a product and becomes a tool of power in things like trade wars or geopolitics. And look, this isn't some crazy what-if scenario. Back in 2019, during the trade tensions with the US, commentators in China were openly suggesting that Beijing could cut off antibiotic exports to fight back against American tariffs. The threat was put right out there on the table. And then, COVID-19 happened. It was like a terrifying, real-world stress test of this exact vulnerability. When the virus slammed Hubei province, a huge hub for drug manufacturing, the Chinese government did what any country would do. It focused on saving its own people. It nationalized medical supplies and shut down exports. The tap for the rest of the world was just turned off. And we all remember the result. Immediate, crippling shortages of protective gear, and a very real fear that we would run out of essential drugs. So where does that leave us? What does all this actually mean when you put it together? When you add up the quality problems, the system's fragility, and the very real possibility of it being used as a weapon, you end up at a pretty sobering place. This next quote, man, it just says everything. A country that relies on foreign powers for its essential medicines is essentially outsourcing its survival. We did it for efficiency, for lower costs, but in the process, our ability to fight infections, to perform surgery, to literally care for our sick now depends on another country. So to wrap your head around it, think of it like this. The journey of your medicine is in danger from 3 different directions, from hidden quality failures because we can't see the whole supply chain,
from accidental shortages because the system is so brittle, and finally, from being used as a weapon in a global power struggle.
All right, let's get right into it. We're going to talk about something you might have actually gone through yourself, the absolutely bizarre disappearance of one of the most common antibiotics in the world, amoxicillin. And this story, believe it or not, pulls back the curtain on a massive vulnerability right at the heart of our medicine cabinet. I want you to think back to late 2022. If you had a sick kid, this wasn't just a headline, this was your reality. You go to the pharmacy and they just can't fill the prescription for amoxicillin, a drug that's been a go-to for 50 years? It felt impossible. So what on earth was actually going on? Now, the official story we all heard was pretty simple. This tripledemic of RSV, the flu, and COVID hit all at once, and demand just went through the roof. And look, that's true. Demand was way up. But here's the thing. Demand surges happen. A healthy, resilient system is built to handle that. The real problem, the reason the shelves were literally empty, wasn't a failure of demand. It was a complete and utter failure of supply. To really understand this, we have to look way beyond your local pharmacy counter. We've got to trace that little pink pill all the way back on its journey, across oceans, across continents, and deep into a part of the manufacturing process that most of us never ever see. And frankly, a part that even regulators don't see that well either.
You see, making a drug isn't just one step. It's this long, complicated chemical journey. And what's so critical to see here is how many of these early steps happen before any of the strict rules and regulations really kick in. It creates this huge gray area, this massive part of the process that's kind of flying under the radar.
The bright, clear line in all of this is something called GMP, or Good Manufacturing Practices. Just think of GMP as the absolute gold standard for safety. It's the super strict, non-negotiable set of rules for everything: cleanliness, quality checks, tracking every single ingredient. At the end of the day, GMP is the system that's supposed to guarantee that the pill you take is both safe and actually works.
And this right here is the central problem. Running a plant that meets GMP standards is incredibly expensive. It costs a ton of money. So naturally, there's this huge financial incentive for companies to do as many of the manufacturing steps as they can in cheaper, non-GMP facilities. They want to start that expensive GMP clock as late in the game as humanly possible.
Which brings us to this really important term, the key starting material, or KSM. Now, this isn't just another chemical on the list. You should think of it as a line in the sand. It is the exact point in that long production chain where regulators like the FDA say, okay, stop. From this molecule forward, those expensive, strict GMP rules are now in full effect.
And because of that, you end up with what you could call a regulatory dark zone. Basically, everything that happens in the shadows before that KSM is defined, well, it can be a total blind spot. A supplier halfway around the world could switch out a cheap ingredient to save some money, and regulators might have no idea until a major problem shows up in the final drug.
All right, so we've got this hidden, barely regulated part of the supply chain. How in the world does that lead to your pharmacist saying they can't fill your kid's prescription? Let's connect the dots and bring it all back to amoxicillin.
You know, this problem didn't just pop up out of nowhere. Back in the 1980s, the US actually had several plants making the basic building blocks for penicillin. But it's an expensive, messy process. And by 2004, the very last major plant doing this work, in Syracuse, New York, shut its doors. That was it. The US was officially out of the game.
At the absolute heart of the amoxicillin shortage is one single specific molecule, 6-APA. This is it. This is the official key starting material we were just talking about. The best way to picture it is as the molecular skeleton of the drug. You literally cannot build amoxicillin, or a bunch of other essential antibiotics, without this exact starting skeleton.
And here it is, the single most important number in this entire story. What percentage of that critical 6-APA skeleton, the one we need for every single amoxicillin pill in the US market, comes from foreign countries? 100%. Not 99, a full 100%. All of it.
So where's it all coming from? Well, the breakdown is pretty revealing. Our dependency isn't just foreign, it's incredibly concentrated. The overwhelming majority, we're talking about 85%, comes from just a few producers all located in one country, China. So now you can see the dominoes fall one by one. It starts with some disruption, say a lockdown or an energy problem, at a factory in Shandong, China. Suddenly the world's supply of 6-APA powder gets tight. That means a factory in India can't get enough of its key starting material.
which means a factory in New Jersey can't get the finished ingredient it needs to press into pills, which means your local pharmacist has nothing to put in the bottle for your sick child. A single point of failure just cascaded across the entire globe.
Okay, so you might be thinking, but wait a minute. When I go to the pharmacy, I see generics from all these different companies from all over the world. It seems like a pretty diverse, competitive market, doesn't it?
And you're right, you see names you recognize on the bottles. Teva from Israel, Sandoz from Switzerland, or Robindo from India. It gives you this sense of security, right? Like if one company has a problem, another one can just pick up the slack.
But here's the catch. That diversity, it's an illusion. It's a total mirage. Because if all of these different companies are buying their core ingredient, that 6-APA skeleton, from the exact same handful of factories, then the supply chain isn't diverse at all. It's actually incredibly fragile.
And this is why just saying, oh, let's just bring the pill-making factories back to America doesn't solve the real problem. I mean, think about it. If you build a shiny new factory in Ohio, but it still has to import its key starting material from that same unregulated dark zone overseas, you haven't fixed the core vulnerability one bit.
At the end of the day, it all boils down to this one powerful idea. It doesn't really matter where the final pill gets pressed into shape. What truly matters is who controls the foundational ingredients. The control of the ingredient dictates the cure.
For about 30 years, the entire global drug industry was driven by this one single idea. That's it. It was all about making medicine as cheaply and as fast as humanly possible, which meant production was always chasing the lowest price tag, no matter where on the globe that was.
And, we have to be honest here. For a long time, this system worked. It delivered some huge benefits. It made essential, life-saving drugs incredibly cheap and available to millions, maybe billions of people. It was a system built on this just-in-time philosophy that, on the surface, seemed totally perfect.
Well, that era is over. Done. The entire logic that held that system together, this idea of centralized production for a global market, it hasn't just cracked, it has completely shattered. So the big questions are, what broke it? And maybe more importantly, what comes next? Okay, so to really get what happened, we need to quickly cover the basics. Think of it like baking a cake. KSMs, or key starting materials, are your raw ingredients, the flour, the sugar, the eggs. And APIs, the active pharmaceutical ingredients, that's the actual cake. It's the core thing that has the medicinal effect. This flow from raw chemical to finished ingredient, that's the entire supply chain right there.
So with that in mind, let's look at how that old system got built. For decades, it was basically a one-way street, and it was all flowing in the same direction, driven by that relentless efficiency we talked about.
It all really kicked off in the 90s, when Western companies started optimizing for cost above all else. By the 2000s, this created what some have called a gravitational pull, just sucking manufacturing eastward. And by the 2010s, it was a done deal. China was, for all practical purposes, the world's factory for those critical APIs and KSMs. And then, the whole thing just fell apart.
Which brings us right to the breakdown. And look, this wasn't one single event. It was more like a domino effect, a series of pressures that piled on top of each other and exposed just how fragile this supposedly efficient system really was.
It basically happened in 3 steps. First, you had rising geopolitical friction that started to create some cracks in the foundation. Then, the pandemic hit, and that delivered these massive global supply shocks that turned those small cracks into giant fissures. And that led to the final step. Nations everywhere woke up and started looking at their medicine supply in a completely different light, as a matter of national security.
So, what was the big lesson here? Well, the world learned that a centralized system is an incredibly vulnerable one. That hyper-efficient just-in-time model, it suddenly became just not there. And governments realized that being able to make your own medicine is just as critical as, say, controlling your own power grid.
But here's the thing. This story isn't just about collapse. It's really about what's being built right now to replace the old system. We are literally watching the birth of a new, multipolar world for pharmaceuticals.
For a while there, the whole conversation was reactive. It was all about the risk, the danger of relying so heavily on just one country for all of our essential medicines.
But that has totally changed. The world is now being proactive. This isn't just about moving away from one source anymore. It's about building multiple, resilient, independent hubs of production all over the globe.
And you can see this new map taking shape as we speak.
There's massive investment pouring into India, especially around Hyderabad's huge fermentation facilities. You've got Europe reshoring production to its high-tech chemical parks. Brand new biotech zones are popping up in places like Vietnam. And in the West, we're seeing this concerted effort to resurrect chemical capabilities that have been collecting dust for decades.
So, what's the big takeaway from all this? Well, it signals this profound shift in what the world values. We're in a new era where public health and geopolitics are completely intertwined. Think about it like this. The old logic was simple: relentless efficiency, rock-bottom prices, and put everything in one place. The new logic, it's a totally different language. It's about strategic resilience, national sovereignty, and why having diversified supply chains is an absolute must.
And this, right here, is the bottom line. The ability to control the supply of the basic molecules that make our medicines is now seen as a core part of a country's geopolitical power. Full stop.
To really put this into perspective, for decades, we've understood that energy security is power. More recently, the entire world has woken up to the importance of controlling semiconductors. Well, you can now add pharmaceutical sovereignty right next to them on that list. It's considered just as critical for a nation's strength and independence.
All right, we're talking about a really high-stakes battle for the future of America's medicine cabinet. On one hand, you've got the United States, this absolute powerhouse of pharmaceutical innovation, creating all these cutting-edge, space-age drugs. But on the other hand, the country found itself almost completely unable to manufacture the most basic, essential medicines. You know, the stuff that forms the very bedrock of our entire healthcare system. So you gotta ask, how did we even get here? Well, that's what we're gonna break down. First, we'll unpack this unseen crisis. Then, we'll look at America's plan to fix it and the policy war that it accidentally created. After that, we'll get into the price of resilience and what this all means for corporations. Okay, let's jump in. So, the root of this whole crisis, you're not going to find it in some high-tech, cutting-edge lab. Well, it's actually in that humble, generic pill you probably pick up from the pharmacy all the time. Okay, take a look at this, because it really reveals a massive imbalance. Generic drugs, they make up a staggering 90% of all prescriptions filled in the US. 90%! But now, look at the money side. They only account for 13% of the total spending. That creates this incredibly low-profit environment for what is, let's be honest, the bedrock of our medicine supply. And right there, those razor-thin margins, that's the real root of the problem. I mean, to make any money at all on these super essential but really cheap drugs, companies basically had no choice. They had to go chase lower labor costs, less regulation. So what happened? Manufacturing packed its bags and moved almost entirely overseas to places like India and China. And that created this long, super fragile supply chain that officials are now calling dangerously brittle. Okay, so the government sees this. How did they respond? Well, faced with this pretty critical vulnerability, Washington actually acted really decisively. They launched this whole new industrial policy designed to do one thing: bring that manufacturing back home. The playbook was pretty clear, really. It was a three-pronged attack. Step one, cut through all the red tape and bureaucracy that made building factories in the US take forever. Step two, level the playing field, address the unfair advantage foreign plants had with their kind of lax oversight. And step three, build a national safety net, a buffer for all the raw materials. And they moved fast. The plan was, by May of 2025, an executive order would come down to slash that 5 to 10 year timeline for building a new drug plant by just fast-tracking all the permits. Then, just a few months later, in August, another order would get the Strategic Ingredient Reserve, they called it SAPIR, up and running. And this was a huge conceptual leap, a real game changer. Instead of just storing pills that have an expiration date, SAPIR is all about storing the raw, active pharmaceutical ingredients. Think of it this way: it's like stockpiling flour and yeast instead of already baked bread. This creates a buffer that could keep US factories running for months, not just days, if a crisis ever hits. But just as this big engine of American industrial policy was roaring to life, a massive problem started to emerge. It turns out the government was unintentionally hitting the gas and the brake at the exact same time. You had two major policies working in direct opposition to each other. Okay, so on one side, you've got the Inflation Reduction Act, or the IRA. Now, this was a huge political win, and it was designed to do something everybody wants: lower the cost of prescription drugs for millions of Americans. And it does that by letting Medicare negotiate prices directly with the drug companies. Then, on the other side, you have that reshoring initiative we just talked about. That's the whole collection of policies designed to bring manufacturing back to the US. Its goal is totally strategic. Get companies to pour massive amounts of money into building new factories on American soil, all for the sake of national security. And here is where it all collides. The IRA's whole purpose is to lower industry revenue to save you money. But the reshoring plan requires that same industry to have more capital, more cash, to invest in these really expensive US factories. You see the problem? You can't take billions of dollars out of an industry with one hand and then expect it to spend billions more on new projects with the other. It's basically a zero-sum game. And this isn't just some political headache, by the way. It actually has a name in economics. It's called the capital allocation trade-off. And it's pretty simple when you break it down. When companies make less money on their big, high-profit blockbuster drugs, they have way less cash lying around to invest in low-profit projects. Like, you guessed it, the very same generic drug factories the US is desperately trying to build. So this conflict really forced a brand new question to the forefront. If the government is squeezing the industry's profits, what other tools can it possibly use to bring these factories home? And maybe more importantly, who's going to end up paying the price for that security? Well, one idea that got floated was tariffs. Basically putting a tax on imported drug ingredients. But critics immediately jumped on this, calling it a blunt instrument. And here's why. Just taxing foreign suppliers doesn't magically make domestic factories appear overnight. The fear was it could just make the drugs we already have more expensive, or even worse, cause immediate shortages if foreign companies just decide to stop selling to the US market. And the potential cost to you, the consumer, is pretty significant. A study from Yale University projected that a 25% tariff on these ingredients could jack up the annual medication bill for the average American household by around $600. That's not nothing. So this whole thing kicked off a debate between two different kinds of incentives, push versus pull. Tariffs are a push incentive. You're punishing foreign suppliers to try and push them away. But the industry argued for a pull incentive, something like the government guaranteeing contracts. That would pull companies to invest in the US because it promises them a stable customer and, it seriously reduces their financial risk. So where does all this leave us? Well, this clash of policies isn't just some theoretical debate happening in Washington. It's created this huge cloud of uncertainty that is already influencing how corporations are behaving and what the future of America's drug supply is going to look like. At the end of the day, the final equation for these corporations is pretty stark. Look, it costs hundreds of millions of dollars to build a new drug plant. At the same time, the IRA makes any future profits totally unpredictable. So what's the result? Well, by late 2025, reports started showing that companies were already hitting the pause button on major US projects. They prefer to invest their money in countries where the pricing policies were just more stable and predictable.
For decades, you've probably heard India called the pharmacy of the world. And honestly, it's a fitting title. Its gigantic industrial base can churn out generic drugs like nobody's business, supplying affordable medicine to countries all over the globe, including the US.
And this is where the scale of the problem becomes crystal clear. For years, nearly 70%, let that sink in for a second, 70% of all those essential ingredients that Indian drug makers were using had to be imported from one single country, China.
And that is the absolute heart of the problem. In any kind of geopolitical dust-up, India's entire pharmaceutical engine, this global powerhouse, could be completely shut down. All it would take is for someone to turn off that tap of raw ingredients.
So, facing this really serious threat, did India just sit back and hope for the best? No way. It launched one of the most ambitious industrial projects we've seen in a long time, a genuine industrial rebirth.
Their solution was something called the Production Linked Incentive Scheme, or PLI for short. And this wasn't some minor policy tweak. We're talking about a massive government subsidy program, laser-focused on one thing: jump-starting domestic production of those exact KSMs and APIs that India was so dependent on. And the amount of money involved here is just staggering. The program has already kickstarted investments worth over 40,000 crore rupees. That's a huge number that blew right past the government's original targets.
And this wasn't just money moving around on a spreadsheet. No, this capital infusion led to real, tangible results.
Over 350 new manufacturing units have been commissioned. That includes 28 brand new projects built from the ground up just to make molecules that hadn't been produced in India for decades.
You know, the impact goes way beyond just the factories. This scheme created nearly 97,000 new jobs. It's weaving this new pharmaceutical independence right into the social and economic fabric of the country.
If you want a fantastic example of this whole thing in action, look no further than penicillin G. For decades, China basically had a monopoly on making it. India didn't produce it at all. But now, thanks to this PLI scheme, commercial production is starting up again. That's a huge win, both symbolically and strategically.
So when you boil it all down, what India is building is a strategic insurance policy. It's a policy that doesn't just protect its own healthcare system, but also helps protect all the global markets that depend on Indian medicine from really dangerous supply shocks.
But here's an interesting twist in the story. India's big push for independence wasn't a solo mission. It got a massive boost from a deepening strategic partnership with another global power that was facing the very same problem, the United States. See, both Washington and New Delhi looked at the global map and came to the same simple conclusion. Trying to untangle their critical supply chains from China was too big a job for either of them to do alone. They absolutely needed to work together.
And this led to a strategy you might have been hearing about called friendshoring. The idea is pretty simple, but it's powerful. You actively push your companies to get their materials and make their products in friendly, allied countries. Why? To lower the risk that comes from geopolitical tensions.
So what you get is this pact that's a total win-win. For the United States, India is pretty much the only country that has the scale to be a real alternative to China for generic drugs. And for India, this partnership opens up the huge US market and gives them vital technical help to meet those super strict FDA quality standards.
And this isn't just talk. This partnership was cemented with real agreements, like the Initiative on Critical and Emerging Technologies, or ICET. Even more specific was the US-India Trust Initiative, which was launched specifically to make the biopharma supply chain between the two nations work better.
So, what does this all mean for the future of medicine? Well, this new alignment between the US and India is fundamentally changing how and where our medicines get made.
Now, that's not to say it's all perfect. There are definitely some points of friction. There are still worries about protecting intellectual property, the environmental impact of all this new industry, and of course the high costs for Indian companies to meet US standards.
But, and this is the crucial part, the overall geopolitical goal is so important to both sides that these issues are seen as technical hurdles that need to be worked out, not strategic roadblocks that will kill the deal. The bigger picture is what keeps driving this whole thing forward.
And you can already see the proof in the numbers. The stuff coming out of this new initiative already makes up 30% of India's bulk drug exports and more than a quarter of its formulation exports. This whole pivot isn't just some plan for the future. It is working right now.
Today, we're going to break down the EU's huge strategic pivot, away from just cheap imports to something way more ambitious, what you might call pharmaceutical power. So, for decades, the rule was just dead simple. Whoever could offer the cheapest generic drug, well, they won the contract. This created what's known as a race to the bottom, and it had this massive unintended consequence. It basically drove local European manufacturers right out of the market and concentrated the production of essential medicines into the hands of just a few low-cost producers, mostly in Asia. And this, as you can imagine, left the entire continent just incredibly vulnerable to any kind of supply chain shock. Okay, so faced with this obvious fragility, the EU didn't just try to put a Band-Aid on the system. No, it developed a whole new philosophy. This is a move from being a passive customer, always looking for the cheapest deal, to be an active player that wants to shape its own security. And the core idea behind this whole thing is a concept called strategic autonomy. Now, what's really important here is that this is not about isolationism, building some kind of fortress Europe. Not at all. It's about having the ability to stand on your own 2 feet when you absolutely have to, while still being totally open to the world. It's about resilience, not retreat. So how do you actually do that? Well, the EU's plan is kind of like a two-pronged attack. First, they decided they had to get their own house in order. They needed to fix the very system that created this mess in the first place. And let me tell you, they moved fast. In 2024, they set up the Critical Medicines Alliance just to get all the key players talking to each other. By 2025, they were already proposing a brand new legal framework, the Critical Medicines Act, to turn all that talk into actual, concrete policy. And what I think is really smart about this act is its methodical three-step approach. It's super logical. First, you map out every single vulnerability to figure out exactly where your weak spots are. Then you identify the absolute must-have medicines, the ones you just can't live without. And finally, you create a solid plan to make sure you always have them, using a mix of stockpiling and, crucially, diversifying your suppliers. But this right here, this slide, this is the real game changer. The EU is completely rewriting the rulebook for how it buys medicine. The old system was easy. Lowest price wins, that's it. The new system is all about the best value. Now, price is still a factor, of course, but now it's weighed against other really critical things. How secure is the supply? What's the environmental impact? Are decent social standards being met? This one change completely alters the entire market. But, fixing the internal market, that was only half the battle. The other and equally important part of the strategy was to look outward and build a totally new kind of global partnership. And this right here is the perfect example of that external strategy in action. In January 2026, the EU finalized a massive free trade agreement with India. Now, this wasn't just another trade deal. This was a very deliberate geopolitical move to create a secure, resilient pharmaceutical supply chain that was frankly less dependent on China. And the sheer scale of this deal is just huge. We're talking about getting rid of tariffs on over 90% of trade lines between these two economic giants. This is a massive liberalization of one of the most important trade routes in the world. And just to put that into perspective for you, before this deal, some of the key chemical ingredients needed for medicines coming from India could face tariffs as high as 22%. By tearing down these barriers, the EU is basically rolling out the red carpet for a key strategic partner. Now, this whole transition isn't just happening overnight. The deal is being phased in over 5 to 7 years. And that's really smart policymaking. It gives European industries some breathing room to adapt to the new competition while sending this crystal clear signal to India that this is a serious long-term commitment. So why does this work so well for both sides? Well, for the EU, it's pretty simple. They get secure access to India's enormous and reliable manufacturing base for generic medicines. And for India, this is a huge vote of confidence. It validates the quality of their entire pharmaceutical industry and gives them unprecedented access to one of the richest and most highly regulated markets on the entire planet. It's a true win-win. So, what does all this add up to? When you put the internal fixes and the external partnerships together, you start to see that the EU isn't just solving a problem. It's basically writing a whole new playbook for global trade in the 21st century. It's this two-part strategy, and the pieces just fit together perfectly. Internally, you've got the new procurement rules that create a market that actually pays more for security and reliability. Then, externally, the free trade agreement with India builds that secure alternative supply chain to meet the new demand. See how that works? This quote right here really just gets to the heart of the entire strategy. The EU is basically accepting that a secure medicine might cost a little bit more. So they're using their massive healthcare budget not just to buy pills, but to buy security. It's a fundamental redefinition of what value even means. Okay, let's dive into this. In the massive global race to produce medicine, not everyone is actually running the same race. While a lot of countries are sprinting to make things cheaper and faster, a couple of others are playing a completely different game, a much, much more valuable one. So this is the multi-billion-dollar question, right? When you're up against these global giants who can produce stuff at a fraction of your cost, how do you even stay in business, let alone lead the entire world? Well, the answer is as simple as it is brilliant. You just don't. You don't compete on their terms at all. Instead, you completely change the rules of the game. You build a fortress of value, of quality, and of complexity so high that almost no one else can even think about scaling the walls. And today, we're looking at two countries that have absolutely mastered this: Germany and Switzerland. So here's the crucial split. On one side, you've got the volume game. This is all about making the essential, everyday drugs we all rely on at a massive scale and super low cost. But on the other side, you have the value game. And this isn't about volume at all, it's about mastering the most complex chemistry on the planet. All right, let's move to our first fortress and see exactly how this is built. We're starting with the industrial engine of Europe, Germany. Their whole strategy is built around this powerful and, uniquely German concept. Their secret weapon is called the Verbund. Now, it might sound a little complex, but the idea behind it is incredibly elegant, and it's the absolute foundation of Germany's competitive advantage in the entire chemical world. What you're looking at here is basically a circular economy on a massive industrial scale. Just picture a huge park of factories, all physically connected by pipes. It's like a perfectly choreographed industrial dance where absolutely nothing is wasted. The process is really simple when you break it down. Factory A finishes its job, and what would normally be industrial waste gets piped right next door to Factory B, which then uses it as its main raw material. The result? Just insane efficiency. It's what helps German manufacturers overcome much higher labor costs and stay globally competitive. But, the Verbund was just the foundation of the fortress. To make the walls truly unbreachable, Germany integrated a cutting-edge technology that pretty much changed everything. Let's just compare the old way with the new. Traditionally, you'd mix chemicals in these giant vats, kind of like industrial-scale soup making. It works, sure, but it's not very precise. Flow chemistry, on the other hand, runs continuous reactions inside these small, highly controlled pipes. Honestly, it's the difference between using a bucket and a laser scalpel. And why does that even matter? Well, it's because the super complex molecules you need for modern cancer and immunology drugs require this incredible level of precision. A lot of these reactions are just way too unstable to be done in a giant vat. So when you combine this tech with AI that's monitoring quality in real time, you get a quality fortress that's almost impossible for anyone else to replicate. So the bottom line for Germany is this: they've made themselves an essential upstream supplier. They don't always make the final pill you take, but they masterfully create the critical, complex ingredients that basically no one else can. And that makes them a vital and incredibly powerful node in the global supply chain. Now let's pivot to our second fortress, Switzerland. If Germany's fortress is built on this incredible efficiency and quality, Switzerland's is built on something else entirely. Just pure, unadulterated complexity. This quote really says it all, doesn't it? The Swiss looked at the market and basically decided their defense wouldn't just be high walls, but a moat so complicated and so difficult to navigate that rivals wouldn't even bother trying to cross it. So what does complexity actually mean here? Well, it means specializing in biologics. These are drugs that come from living organisms, and cell therapies that require ridiculously intricate supply chains. It means products that need to be kept at ultra-cold temperatures, all the way from the factory to the patient. And crucially, it requires a workforce so highly skilled they can co-develop brand new manufacturing processes right alongside the drug's inventors. The champions of this model are what we call contract development and manufacturing organizations, or CDMOs, like the giant Lonza. Now, these are not just factories for hire, no way. They are innovation partners. A biotech startup might invent a new therapy, but they go to a company like Lonza to figure out how to actually produce it safely and at scale. And if you want to know just how important this is, look no further. This site in Visp, Switzerland, is where the world turned to scale up manufacturing for the Moderna vaccine during the pandemic. It was a perfect example of their unique capability on the world stage, and a pretty stark reminder of how much the world relies on these specialized hubs. And that expertise hasn't gone anywhere. Today, that very same site is a critical hub for producing the next generation of personalized mRNA therapies designed to fight cancer. They really are manufacturing the future of medicine. Okay, so we have two different fortresses, two very different strategies. Let's bring it all together to really understand their combined, indispensable role in global health. So here's the breakdown. Germany focuses on ultimate efficiency and quality through its Verbund parks to produce the critical ingredients. Switzerland, on the other hand, focuses on navigating mind-bending complexity with its CDMO partners to produce the finished novel therapies. You see, they're really just two sides of the same high-value coin. Okay, so why should any of us really care about these national economic strategies? What's the ultimate takeaway from all of this? Here it is. While mass-market antibiotics and generics might be made elsewhere, the breakthrough cures for the most challenging diseases out there, we're talking cancer, rare genetic disorders, are born from the unique ecosystems inside these fortresses. This concentration of cutting-edge capability means they're not just tackling problems no one else can, they're literally shaping the future of global health. So let me just ask you something. When you think about the most advanced, life-changing medicines out there, where does your mind go? A biotech hub in Boston, maybe? A huge lab somewhere in Switzerland? And look, you wouldn't be wrong. but you'd be missing a huge piece of the puzzle. Because the very foundation these incredible therapies are built on actually comes from Japan. It's the silent giant, not in making the final pills you buy at the counter, but in creating the absolutely irreplaceable ingredients that make them work in the first place. So let's get into how they do it. All right, first up, we have to talk about the art of the ingredients. This is where Japan's unique strength really shines. And honestly, it comes from some pretty unexpected places. This right here perfectly sums up their whole strategy. It's kind of fascinating. On one side, they import tons of common, finished generic drugs. But on the other side, what they export is something else entirely. We're talking about the super specialized, high-tech building blocks for the world's most advanced medicines. See? They're not trying to compete on volume, they are all in on value. So what exactly are these building blocks? I mean, we're talking about materials made with just unbelievable precision. Things like high-purity chemical precursors, specialized amino acids, and especially these advanced lipids. You can think of them like the protective little bubbles that deliver the medicine, and they are absolutely essential for modern DNA and RNA therapies. These aren't just ingredients, they are the highly engineered chassis for the next generation of medicine. So how did they get so ridiculously good at this? Well, a huge part of the answer is this concept right here, monozukuri. And it's so much more than just a word for manufacturing. It's a whole philosophy, you know? It's an ethos of craftsmanship and a relentless, almost obsessive pursuit of perfection. It's about building quality into the very soul of the process. And this is the perfect example of how it works in the real world. A company like Ajinomoto, which, yeah, most of us know for food seasonings, took its deep expertise in things like amino acids, applied that monozukuri spirit, and just pivoted. They became a world-leading, indispensable supplier for the biopharma industry. It's a wild leap to go from the kitchen to the clean room, but they did it. But here's the thing. This wasn't some happy accident of culture and corporate genius. Nope. Japan's dominance in this very specific niche, it was carefully cultivated. This was a niche that was built by design. Japan's Ministry of Health was a key player here. They did something really smart. They created these fast-track approval processes for therapies targeting rare diseases and for pediatric medicines. And that move was crucial. It basically steered companies away from competing on cheap generics and pushed them to master these complex, high-value markets where precision and quality are absolutely everything. Now, this incredibly specialized industry they've built isn't just content to be a silent partner anymore. It's now stepping onto the world stage with some serious global ambition. Just take a look at this number for a second. $3.4 billion. It's a huge figure, and it really represents a major turning point in this story. That number, that was the price tag for the recent acquisition of Mitsubishi Tanabe Pharma. This isn't just another business deal, it's a massive statement. It signals a whole new strategy of taking that world-class Japanese R&D and aggressively scaling it for the entire global market. The quiet giant is definitely starting to roar. And it's not an isolated event either. Just look at a company like Takeda Pharmaceuticals. Over the years, they have systematically transformed themselves from a big name in Japan into a true global powerhouse, with a huge presence in the US and Europe. So the pattern here is crystal clear. Japan is going global. But there's one final piece to this whole puzzle, and honestly, it might be the most impressive part of all. It's not just about what Japan makes, but what it can deliver. We're talking about mastering the unbreakable cold chain. This quote really says it all. I mean, think about it. Modern medicines, especially things like cell therapies, are incredibly fragile. Some of them are literally living treatments that need perfect temperature control from the second they leave the factory to the moment they reach the patient. It's a logistical nightmare, and Japan has turned it into a science. So let's just trace this journey. A living therapy is created in Tokyo, it's packaged, it's shipped across the world, and it's delivered to a hospital in, say, Texas, all while staying at a perfectly stable, often freezing temperature. Any mistake, any deviation by even 1 single degree, and the medicine is completely useless. It's an absolutely incredible feat of precision logistics. And that capability, that complete mastery of the unbreakable cold chain, that's what cements Japan's role not just as a manufacturer, but as a true logistical superpower. It's the final, critical link that makes sure these advanced medicines can actually get to the people who need them. You know, for the longest time, if you looked at a map of where our medicines come from, it was pretty predictable, dominated by just a handful of industrial powers. But that map, it's being completely redrawn right now as a massive global shift gets underway. The old model is being seriously disrupted, not by a single country, but by this powerful new wave of players who are stepping onto the global stage. Yeah, we're talking about the global south. And you gotta understand, the motivation here is absolutely key. This isn't just about business. It's a very deliberate pivot. It's driven by two really powerful forces: the hunger for economic growth and the urgent need for health security. These nations are just no longer content to be consumers. They're absolutely determined to become producers. Okay, so to really get our heads around this transformation, we're gonna take a quick trip around the world. We'll start in Southeast Asia to see what Vietnam's up to. Then we'll head over to Latin America to look at Brazil, and finally explore the incredible continent-wide mission taking shape in Africa. Then we'll pull it all together to see what this new pharma map means for all of us. All right, first stop, Vietnam. The country is moving incredibly fast to position itself as the China +1 destination. You've probably heard that for electronics, right? But now it's for pharmaceuticals too. It's a classic economic diversification play, and they are not wasting any time. And listen, this is no small-time ambition we're talking about. I mean, look at this number. The Vietnamese pharmaceutical market is projected to hit a staggering $11.6 billion by 2033. A number that big signals a massive domestic market and a huge opportunity for growth that is definitely getting global attention. So the big question is, how are they going to pull this off? Well, the government has set these super aggressive targets for 2030. They want to meet 80% of their own drug needs and start producing more raw materials at home. And to make it all happen, they're doing the smart thing, creating these specialized biotech parks with great tax incentives and way less bureaucracy, all while using trade deals to plug right into the global supply chain. It's a really comprehensive and very clever strategy. Okay, let's hop over to Latin America now, where Brazil is without a doubt the regional leader. And Brazil, well, they're playing a totally different game than Vietnam. Instead of starting with a low-cost export model, Brazil is using its huge, powerful internal market to build its pharma base from the inside out. So what's Brazil's secret weapon? It's this. Their regulatory agency is world-class, totally aligned with top global bodies like the FDA in the US and the EMA in Europe. That alignment, it basically gives them this instant stamp of approval, of quality. It makes Brazil a super trustworthy and attractive partner for companies looking to nearshore production. You know, move manufacturing closer to their customers for the entire Americas. And Brazil's strategy is honestly, it's brilliant and super methodical. Okay, so first, the government steps in with its massive purchasing power to guarantee a market. That, of course, incentivizes companies to set up shop locally. Then, they offer these long-term contracts to make it even more attractive. And here's the kicker, there's a condition. You want our business? You have to transfer your technology. It's this powerful cycle that's designed to slash their reliance on imports and build a high-tech export hub. All right, our last stop on this tour, and this one, it feels maybe the most urgent. The transformation that's happening across Africa, it's driven by something more than just economics. It's really a moral imperative. It was born from some incredibly hard lessons learned not too long ago. I mean, this quote just says it all, doesn't it? Think back to the pandemic. That experience of vaccine nationalism, where wealthy countries basically hoarded all the supplies, it was a deeply traumatic event. It exposed the continent's vulnerability and created this absolute ironclad resolve to never, ever be in that position again. So, in response to that trauma, the African Union launched this incredibly bold initiative. Look at this goal, 60% of all the continent's vaccines made right there in Africa by 2040. This isn't just a small tweak. This is a fundamental restructuring of health security. It's a declaration of independence. Okay, so you're probably thinking, how on earth do you make a goal that huge a reality? The answer is collective action. The African Pooled Procurement Mechanism, the APPM, is a total game changer. Instead of having, 54 smaller, separate markets, the APPM lets all these different African nations negotiate as one giant block. And that gives manufacturers the scale and the guaranteed sales they need to actually invest in local factories. It's just a brilliant solution to a problem that's plagued the continent for a long time. Okay, so let's zoom out for a second. We've just looked at 3 totally different regions on 3 different continents, right? And they're all marching in the same direction. What we're really seeing here is the birth of a totally new decentralized map of medicine. And this really breaks it down nicely. You can see how everyone's taking a different path to get to the same destination. You've got Vietnam going for that low-cost export hub model driven by pure economic strategy. And there's Brazil, using its huge home market to become a regional powerhouse. And finally, Africa, using collective action, all driven by this powerful quest for health security and justice. 3 different strategies, one single unified trend. So if there's one thing to take away from all this, it's this. What we've just seen isn't a coincidence. This isn't just a few random, isolated projects. No way. This is a cohesive, powerful, and honestly, probably permanent global trend. The world of pharmaceutical production is fundamentally shifting away from the old centers of power.
The story of modern medicine is not just about biology and chemistry anymore. No way. It's a story of geopolitics, of geology, and the absolutely incredible challenge of just moving things from point A to point B. At the end of the day, it's a story about power.
So let's start by digging deep. Let's get into the first hidden layer of this new reality, the minerals buried deep inside the earth that make all of modern medicine even possible.
We all see the trade in finished drugs and their chemical ingredients, but that's just the surface. That's the tip of the iceberg. What's hiding underneath is this foundational reliance on very specific elements, a dependency that's much harder to see and a whole lot more difficult to change. And this is where it gets really specific and honestly kind of mind-blowing. We're not talking about generic stuff here. Modern medical tech is hungry for these exact elements. Platinum? It's not just for jewelry. It's absolutely essential for life-saving pacemakers and even chemotherapy drugs. That crucial MRI scan you might need? Well, it totally relies on a rare earth element called gadolinium. And every portable medical device, every hospital battery backup, they all need lithium.
This chart just lays the problem bare, doesn't it? The supply of these critical minerals isn't spread out nice and evenly across the globe. Oh no, it is heavily, dangerously concentrated. And that creates this massive vulnerability in the global health system, a single point of failure that nations are now scrambling to solve.
So what happens when everyone wakes up to this vulnerability at the same time? You get a fierce global competition. It's a new scramble, not for territory in the old school sense, but for the raw materials that power both our green future and our health.
And here is the kicker, the absolute heart of the conflict. The exact same minerals we desperately need for the green energy transition, for all those EV batteries and wind turbines, are also non-negotiable for our health security. You've got 2 massive global priorities competing for the exact same finite resources, and that's driving up prices and turning these little rocks into major strategic assets. The result? A whole new wave of geopolitical maneuvering. Forget old alliances for a second. The new game is all about securing access to mines. Powerful nations are racing to lock down supply chains, starting in places like Africa, South America, and Australia. And in the process, they're forging new partnerships and creating brand new tensions.
You see, this changes everything. It forces us to completely rethink what health security even means. It's no longer just about having enough doctors and hospitals. Today, national health security is directly, inextricably linked to the mining sector. It depends on geology. Who would have thought?
But hey, securing the minerals is just the start. So you've got the raw materials, problem solved, right? Not even close. Let's move to the next layer and see how this gets even more complex. The incredibly fragile journey of getting the final product to the patient.
We're not shipping simple aspirin tablets anymore. Many of the most advanced medicines, these things called biologics, are incredibly sensitive. They have to be kept within a super precise temperature range from the second they leave the factory to the moment they get to the pharmacy. This is the cold chain, and if it breaks, even for a little bit, the medicine is rendered completely useless, worthless.
The journey of a single dose is a high-tech marvel. It's like a relay race against time and temperature. After it's made, it gets placed in a specialized smart container. These containers, often from brilliant firms in Japan and Europe, use Internet of Things sensors to monitor the temperature and location in real time, 24/7, as it crosses an ocean.
And this leads to a critical, game-changing realization. You can build the most advanced, most expensive drug factory in the world, but if you can't move those fragile little molecules safely across a contested ocean or through a backed-up port, that factory is worthless. The logistics, the shipping container, has become just as vital as the manufacturing itself.
So, we have a global scramble for minerals and a revolution in logistics. What happens when you smash those two forces together? Well, you get a massive coordinated effort to completely redraw the global map of medical production.
Look at these years, 2025 and 2026. This is the turning point. This is the moment the world fully woke up, the end of what you could call the era of pharmaceutical innocence. It became undeniable that supply chains for life-saving medicines are strategic national assets. You just can't leave them to chance anymore.
And this has triggered a fundamental shift, a whole new paradigm. It's like we've completely flipped the script. The old model was all about one thing: efficiency. Find the absolute lowest cost, which usually meant relying on a single supplier somewhere far away. The new model? It's the exact opposite. It's built on redundancy and resilience. The goal isn't just to be cheap, the goal is to be secure.
This creates what you could call a new geometry of power. It's not one country dominating anymore, it's a network of key players, each with a role. It relies on the industrial comeback of the US, on Europe's big push for strategic autonomy, India's ambition to be the world's pharmacy, the incredible technical skill of Japan, and the DACH region, that's Germany, Austria, and Switzerland, and of course the rising capabilities of the global south.
So after all that, what does this actually mean? Where does this epic global shift leave us? Let's bring it all home. Let's be real for a second. This transition, it's not easy and it is not cheap. Building a resilient system means we have to accept some hard truths. We are likely going to see structurally higher drug prices. The whole regulatory environment is going to get way more complex. And there are tough trade-offs between spending billions on building new factories versus pure innovation. This security has a cost.
But here's the thing. For all those costs, what's the payoff? What's the promise at the end of all this effort? It's simple, but it's profound. It's a more secure world, one where a country's ability to heal its population isn't held hostage by a single supply line stretching across a contested ocean.
And that is the ultimate takeaway. In the 21st century, controlling the ingredients for pharmaceuticals has become a new frontier of statecraft. The molecule, that tiny thing that can save a life, is no longer just a unit of medicine. It is now a unit of power.